Okay. All right. There we go. Hopefully everyone can see and hear me fine now. I've been having issues with Zoom again, like always, you guys, but here we are. Hopefully we're good to go. I can't see your chat, but I will grab any questions that you have at the end. Once I stop my screen share, I'll be able to see the chat again. All right, well, this might be it. I'll be on the lookout if anyone else shows up. But like I said, we're going to have a nice small group today, which is fun. You guys get more one-on-one attention, right? Today, we are going to talk all about heartburn. Let me get my slideshow. There we go. Okay, so you guys already know the drill. I'm pretty familiar with all of you. So every month, there is a free class available to everyone. And then there is also a class that is only for app subscribers, which right now, this is the app subscriber class on heartburn. Next month, please tune in. It's going to be a great one. It's going to be all about menopause and low testosterone. These are two of my most requested topics that people want to know more about. I'm going to try and keep that class to a reasonable length of time, but it might run a little bit long. And I'm also going to be releasing 2 ebooks with that class, one for menopause, one for low testosterone. It was just too big to cram into one ebook. And next month's bonus class for subscribers only is going to be all about prostate and PCOS. So we're kind of staying along with the hormone theme. And later tonight, you're going to have the replay for this class as soon as Zoom finishes optimizing it. I've already put the ebook that accompanies this class inside the app, so you can grab that anytime. No need to, oh, hold on, we got more people coming. There we go. No need to introduce myself. You guys all know me. Pharmacist Jamie, been doing this for over a decade now. Love to help you guys live your healthiest life. And this is honestly my favorite part, the teaching part, where I can actually spend longer than a minute talking about a subject. So happy to have you guys here. All right, what are we going to cover today? We're going to cover what causes heartburn, when you absolutely must see a doctor, because sometimes people dismiss heartburn as, you know, something minor, no big deal, and sometimes it's pretty serious. And then also, of course, heartburn treatment options. Okay, just the standard disclaimer. I am actually the healthcare provider for a couple of you, but for many of you, I am not. I don't know your personal health history, so all of this class may not apply to you. Please use your discretion, talk things over with your doctor. Don't take anything I say here as a prescription for what you need to do. Everyone's situation is a little bit different. Okay, so let's talk about what causes heartburn. So one of the things that can cause heartburn is too much stomach acid production. This is how everyone tends to treat all heartburn, as if it's an overproduction of stomach acid, but this is actually a little bit rare. It's usually not the problem, but it is possible. Let me just let in a few more people here. Okay. Now, in order to determine if you actually have an overproduction of stomach acid, there is testing that can be done. Testing usually involves a gastrin blood test, or you can also swallow this capsule that will measure the acidity levels within the stomach. Unfortunately, most doctors don't even offer this testing option. I'm not 100% sure why, because the most common cause of heartburn is actually low stomach acid. So treating low stomach acid as if it's too much stomach acid is just going to make the problem so much worse. We'll talk about that in a minute. But yeah, the testing is often not offered to people whatsoever. If you have Zollinger-Ellison syndrome, this is basically tumors called gastrinomas that form in the pancreas and small intestine that can produce high levels of gastrin, which increases stomach acid. That is going to be the type of person who has too much stomach acid. So that person, absolutely, they're going to require PPIs and all of that. Also, chronic kidney failure. That is another reason that someone could have a sudden overproduction of stomach acid. It can lead to increased gastrin production, just like the Zollinger-Ellison syndrome, sorry. And sometimes it's just genetics. Sometimes some people just naturally have an overproduction of stomach acid, unfortunately. Now, a clue about if this is what you're dealing with, if overproduction of stomach acid is the root of your heartburn, is whenever you eat any type of citrus, so, you know, oranges, lemons, anything like that, or when you eat tomato, if that is specifically when you have the burning. So if you have the burning every time you eat it's probably not due to an overproduction of stomach acid. Or if you have the burning when you eat other things, but not the citrus, this is probably not it. If specifically when you eat something that's acidic, like citrus or tomato, that's when you have the burning, you probably have an overproduction of stomach acid. So that's a great at-home clue rather than doing the testing if your doctor does not offer the testing. Okay, what else can cause heartburn? Too little stomach acid. This is extremely common, and it is becoming more and more common all the time because so many modern medications lead to the depletion of stomach acid. That is very unfortunate. Hold on, there's still more people coming in. This is exciting. I thought we'd only have a couple today. Wonderful, love it. Okay, so H. pylori infection, for anyone who doesn't know what H. pylori is, it is a really nasty bacteria that actually burrows into the lining of your stomach and causes damage to the lining of your stomach. The H. pylori will also release a bunch of ammonia, which brings your stomach acid into an even more neutral place. So the H. pylori can actually only survive in a stomach that's not at an ideal pH anyway. Your ideal stomach acid should be like a 1 to 2. The H. pylori can't survive that. So it'll go into a stomach that's already a little bit on the basic side, burrow into the stomach lining, and just pump out a bunch of ammonia, causing the problem to be so much worse. And this is pretty serious because H. pylori will eventually lead to ulcers and even stomach cancers in many cases. So whenever we see an overgrowth of H. pylori, we want to try and eliminate it. H. pylori is normally killed by the proper stomach acid. So it's really important to keep your stomach acid in a good place to begin with. Other things that can cause hypochlorhydria or low stomach acid would be surgery. Unfortunately, sometimes we have to have surgery, but that can throw off your stomach acid. Poor diet, a diet that is consistently really high in processed foods, particularly refined carbohydrates, that can contribute to hypochlorhydria. And unfortunately, age. As we age, our digestive fires kind of start to naturally decline. And another thing that I really want to kind of harp on for a minute, because a lot of people don't know about this, is alcohol. Alcohol will absolutely destroy your oral microbiome. We talk all the time about a healthy gut microbiome, but it all starts in the mouth. People think that, oh, if I use a mouthwash with alcohol, that's going to kill all the bacteria in my mouth. But that's not really how it works. You can never kill all of the bacteria. You're going to kill off all the good bacteria, like the lactobacillus that we want in our oral microbiome, which is going to allow the bad bacteria to grow out of control. You guys might have seen my recent video about Fusobacterium nucleatum, which is something that's caused by dental plaques. It's not killed by alcohol. So it grows there when you don't floss, when you're not, don't have the best oral hygiene, let's say. And then it's supposed to be killed by your stomach acid. However, if you have this growing in your mouth and your stomach acid is not up to par, it can pass all the way through into the colon and it causes colon cancer. So Fusobacterium nucleatum, very scary. It's also been implicated in endometriosis and a few other things. So it's really important, guys, to floss, floss, floss. And please avoid alcohol in your mouthwash. That is like one of the biggest tips that I want to get across to you guys. If you want to use mouthwash, great, that's no problem. Just make sure you get alcohol free. Okay, the alcohol is going to mess up your oral microbiome. It's perfectly fine to use a fluoride mouthwash, or there are various other mouthwashes that don't contain alcohol. That's fine. Avoid the alcohol mouthwash. If you don't believe me, ask your dentist. My dentist was the first one who brought this to my attention, actually. And if you occasionally drink alcohol, you may want to consider adding in a toothpaste or a mouthwash or something like that that restores your natural oral microbiome. I have this one that I use. I don't know if you guys can see it. This is Periobiotic Silver. Of course, it's from Designs for Health, because I love them. But I'm sure there are other options out there as well. I will brush with this every night, and then I brush with my fluoride toothpaste every morning. It's good to use the fluoride as well. It's really good for your teeth. So that is something to keep in mind. If you regularly enjoy alcohol and you don't want to give that up, consider restoring your oral microbiome. You can also eat things like yogurt that have a lot of lactobacillus, and hopefully that can help, but it's not a bad idea to consider the toothpaste as well. Okay, so one way that you can check to see if you have hypochlorhydria, this is an at-home test. It's not a 100% accurate test, but once again, it's going to give you a good idea. So you at least can know for yourself, this is probably what I have going on, chat with your doctor about it, and go from there, is the baking soda test. So the way that you can do the baking soda test at home is you get a quarter to a half teaspoon of baking soda. Put it in 4 ounces, that's a small glass or small cup of cold water, first thing in the morning before you eat or drink anything whatsoever. Drink that down, the baking soda mixed in the water, and then time your burps. If it takes you longer than 3 to 5 minutes to have like a successive series of burps, you probably do not have enough stomach acid. It should happen right away. As soon as that baking soda hits the stomach acid, it should cause it to bubble up. And you should have several burps as well. Sometimes people will do this test and they have one big burp just because they gulped a bunch of water. And I'm like, no, that doesn't count. You should have, a succession of all of this gas coming out of your system. So that's one thing you can try is the baking soda challenge. Another thing that you can try is the betaine challenge. Now, betaine, oh, hold on, we got more people in here. Sorry. Okay. The betaine challenge, betaine is something that you can get over the counter. It's a supplement. Some people take it if they have hypochlorhydria. I took it for a while myself because I had hypochlorhydria due to my celiac that I didn't know anything about. But basically, it's just like an acidic capsule that you can take before you eat if you have hypochlorhydria. So you can take one of those capsules, they're between 375 to 750 milligrams, right before a meal. If you have hypochlorhydria, you shouldn't even notice it. You'll just eat your meal totally normally, not feel anything, which is exactly how I felt when I was taking betaine. If you have normal stomach acid, it's going to burn. You're going to have heartburn because your stomach acid is already sufficient, and now you're adding more acid in on top of it, right? So that is a big clue right there. Now, who wants to go out and buy an entire bottle of betaine just to do the betaine challenge? Probably not many people, but I thought I would go ahead and mention it because it is another way that you can test for this at home. Okay, so a big question that people ask me when I start talking about this is, how on earth does too little stomach acid cause heartburn? It doesn't make any sense intuitively, right? Too much stomach acid, of course, it's going to burn. Too little acid, that shouldn't burn. Well, this is how. Food will sit in your stomach for much longer than it should, not digesting properly since there is not enough digestive fire to break down the food. It can then push back up into the esophagus, or it can even start to almost putrefy in the stomach before finally getting pushed on into the small intestine. So the food is staying there because your body knows, okay, we're not breaking this down. We need to break this down before we move it forward. And then finally it just gives up and keeps going, right? Your stomach acid should have a pH of 1 to 2. If the stomach is not acidic enough and it has a pH of 3 to 4, it's not going to be able to do its job properly, but it will still absolutely burn your esophagus. Your esophagus needs an acidity level of 7, okay? It needs it to be neutral. So even if your stomach acid is a 4, which is absolutely horrible, you're not going to be able to digest your food properly at all, it's still going to really burn your esophagus if some of it refluxes back up, okay? So your esophagus is not able to tolerate literally any level of acid. If you feel uncomfortably full and bloated after meals, even when you don't overeat, especially a meal with protein, this is another sign that you have hypochlorhydria. Okay. Now, this is why I always say that PPI should be RX only. So many people with hypochlorhydria are taking PPI since they feel the burning of their esophagus. They think their stomach must have too much acid, so they'll take a PPI. That's a proton pump inhibitor. Sorry, I'm speaking pharmacist. I need to break it down a little bit. But a proton pump inhibitor, something like omeprazole, this will actually make the problem worse long-term. Taking a PPI when you do not need one, when you don't have an overproduction of stomach acid, will lead to less protein digestion. It will perpetuate heartburn. It might feel good in the moment because it stops the burning in the esophagus, but it's going to just cause more issues in the stomach downstream, right? I see patients who do this all the time. They'll start off on 20 milligrams of omeprazole once daily, right? Which is like your typical dose. Before I know it, they're taking 20 milligrams in the morning and in the evening. Now they're taking 40 milligrams in the morning and the evening. Now they're taking 40 milligrams in the morning and the evening, and they're adding in famotidine. Now they're doing that and they're adding in antacids. You know what I mean? So obviously it's not addressing the heartburn. It's just making it worse. They just don't realize it because it feels good right that second when they take it, but it's just making the problem worse and worse. We really don't want to do this, you guys, because too little stomach acid can lead to very serious health consequences like nutrient deficiencies, anemia, osteoporosis, muscle wasting due to not absorbing and digesting protein properly, just everything. If you're not getting the nutrients from your food, that's a major issue. And by the way, guys, you still get all the calories. I have had people ask me that before, like, well, if I'm not digesting my food, isn't that good? Won't I lose weight? No, you get all the calories. You just don't get the nutrients. Okay, so we talked earlier about H. pylori, which is a bacteria that can only take hold in the stomach with too little stomach acid. This is actually true of all kinds of viruses, bacteria, and pathogens. Stomach acid normally protects us from food and waterborne pathogens really, really well. Okay, it's not many bugs that can live on in the stomach. If you don't have enough stomach acid, you are at risk for things like H. pylori and also things like SIBO, or small intestinal bowel overgrowth, which is an absolute nightmare. You do not want to have to deal with that if you don't have to. I recently did a GI map on myself after we discovered that my daughter had severe anemia. She's actually currently getting iron infusions on a regular basis. That's how bad her anemia was, just to give you an idea, because she had celiac disease. So I decided to do a GI map on myself, and it was the first step in my own celiac diagnosis. And it also revealed that I had hypochlorhydria and H. pylori with the cancer virulence factor. So that was really, really eye-opening for me. I had absolutely no idea this was going on inside my body. I had never had any type of digestive symptom. And who knows, I could have developed stomach cancer out of the clear blue sky 10 or 20 years from now. You know what I mean? We know that stomach and colorectal cancer rates have increased dramatically, way more so than most other types of cancer. I certainly think that our sad modern American diet has a lot to do with that. But I also think that overuse of PPIs is contributing big time. We're not killing off these bacteria and pathogens with our digestive fire any longer. And a lot of people are taking other medications that can suppress stomach acid production as well. So definitely something to consider. Do not just consider these PPIs as, oh, over the counter, no big deal, let's grab them anytime. It's a really serious medication with serious side effects and consequences. Okay, so other causes of heartburn include physical problems with the gastroesophageal sphincter. This is commonly known as GERD, or a hiatal hernia. GERD is when the muscular valve that connects the esophagus to the stomach either spontaneously opens or just does not close properly at all. This allows the contents of the stomach to push back up into the esophagus. GERD can eventually lead to Barrett's esophagus. This is abnormal cells that develop in the esophagus that can lead to cancer, and it is extremely serious. A hiatal hernia is when the stomach slips through the diaphragm into the middle compartment of the chest. I put an illustration here because it can be kind of hard to visualize exactly how this happens without the illustration, so hopefully that can shed some light there. And I also want to mention silent reflux, which is slightly different from GERD and heartburn in that the symptoms are much different. It feels much different for the patient. There's usually no burning in the chest. So I wasn't really sure where to include it in the heartburn class since it's not technically heartburnish for a lot of people, but it is along the same lines. What happens is the acid refluxes up even further. It goes far past the esophagus. It will go all the way up into the voice box. That is why there is no burning in the chest, because it goes all the way up in here, and it actually resembles like a cold or allergies. People who have silent reflux, they'll often have a chronic cough or a sore throat, or maybe just a bitter taste in the back of their throat that they can't get rid of, or excessive throat clearing. If you find yourself just constantly it could be due to silent reflux. You may need to get that checked out. Now, treatment for GERD and silent reflux are often the same, but usually silent reflux will require higher doses of medications for a longer period of time since the acid is traveling so much further and potentially causing even more damage. I just want people to be aware that this is a thing because a lot of times people with silent reflux will go undiagnosed or misdiagnosed for a long time because, like I said, the symptoms don't feel like heartburn. Okay, another thing that can cause heartburn is stress, anxiety, and hormones. So you guys already know, I've talked about it many times, about how stress and anxiety will slow down your digestion. This will contribute to the problem of food sitting in your stomach too long, just like the hypochlorhydria, and it can reflux back up. Hormones. Pregnant women know this very well, or anyone who's had to live with pregnant women know very well how hormones can affect your esophageal sphincter. It's not just that big baby physically pushing on the stomach and esophagus, that is a part of it, but it's also increased progesterone. Progesterone relaxes the esophageal sphincter and basically just allows heartburn to happen so much more easily. Now, women on hormonal birth control, women who are taking the pill, they can also experience a greater risk of heartburn. So that's something to keep in mind. If you or a loved one is taking hormonal birth control and has out of control heartburn, they may want to consider switching to a different form of contraceptive if possible. Hypothyroid, that is another thing that will greatly slow down digestion. We often find that constipation and heartburn are some classic hypothyroid signs. Okay, another thing is poor eating habits. Interrupting our digestion with constant snacking. That is a huge problem. You guys have heard me talk about the migrating motor complex wave, so I'm not going to go on and on about it, but that takes about 3 hours. So spacing out your meals for 4 hours to give that MMC wave the chance to push the food through your system is so incredibly important. Okay, it is going to greatly decrease your risk of heartburn. Also, overeating. This is another risk factor. If you completely stuff yourself, there is a much bigger risk that the food will pop back up into the esophagus. Laying down after eating. This is a huge no-no. Gravity helps to keep your food moving the right way. Eating and then resting is absolutely the worst thing that you can do. I know it feels like after you eat a big meal, you just want to lay down and relax. I totally understand. I feel the same way. But you guys, I'm going to talk about this again and again. Walking for 2 minutes right after eating is so good for you. It balances your blood sugar. It improves your digestion. It keeps your food moving. It is so incredibly good for you. So do what feels the opposite of what it should be, okay? Walk after eating. Do not lay down and rest. Try not to eat right before bed. That is like recipe for disaster when it comes to heartburn. So also a diet high in fried foods releases the hormone, and I know I'm going to butcher this, cholecystokinin. I don't know if I said that right at all. CCK is what we always call it. So, but I figured I should give you guys the official scientific name. But it releases that hormone, the CCK hormone, which relaxes the lower esophageal sphincter. So avoid those fried foods, you guys. Eating them chronically is going to lead to chronic heartburn. All right, when to see a doctor. Number one, whenever you want. You don't necessarily have to meet any of these criteria. If you are suffering, if you are dealing with something that you don't want to be dealing with, go ahead and see your doctor, you guys. Okay, don't take, numbers 2 through 7 as the gospel. Well, I didn't meet one of those. So no, if you want to see a doctor, please see a doctor. Take care of your heartburn. Number 2, if you have intense heartburn or stomach pain on an empty stomach. Okay, you should never have that. If you have that, it is probably the sign of an ulcer. And ulcers can get very serious. If they become bleeding ulcers, they can get deadly. All right, so please, if you have intense heartburn or stomach pain while your stomach is empty, please, please, please see your doctor. If you have severe chest pain or pressure, this could actually be a heart attack. Now, most often in women, we don't see the typical heart attack symptoms of the shooting pain down your left arm, elephant sitting on your chest. Many women will experience a heart attack as heartburn. And I've even seen women who were dismissed from the ER and told, oh, you have heartburn, go take an antacid, who are actually having a heart attack. So if you have that going on, please get it checked out. Okay, number 4, dark blood in the stool. If your stool is very dark, if it is tarry, if it is black, that is usually the sign of a GI bleed. This can once again be extremely serious or even deadly if not addressed, okay? Extreme nausea, vomiting, or vomiting blood. Once again, this could be a GI bleed, can get very serious very quickly. Please get that checked out. Number 6, difficulty swallowing. This could be inflammation of the esophageal tissue, and that should be monitored. Okay, we don't want inflammation of anything in this tiny little area where we get all of our oxygen from. Okay, things can get deadly very quickly when we start having inflammation there. Number 7 is persistent cough and/or hiccups. This could be a sign of a hiatal hernia or silent reflux. So please get that checked out as well. All right, now let's talk about heartburn treatment options. Okay, number 1 is always going to be lifestyle modifications, you guys. If we can treat something just by changing the way that we do things, that's ideal, right? Rather than adding on more medication. So number 1 is avoid fried foods. Like we just said, it releases that CKK. Also avoid carbonated beverages and other food triggers. You may have something that for some reason, this always gives you heartburn. Well, try to avoid that food. It doesn't necessarily have to be on the list of things that typically give people heartburn. We all are unique, we all are individual, and we can react differently to different things. Also, don't eat before laying down. So important. Meal space at least 4 hours. We just talked about why. Avoid smoking and alcohol. I'm not even completely sure the mechanism of action with smoking, but I mean, we see it very clearly in clinical trials that smoking increases your risk of heartburn. Alcohol, same thing I talked about before. It will throw off your oral microbiome. If you do like to partake in alcohol, restore your oral microbiome. Get some yogurt, get a probiotic toothpaste, something to that effect. Avoid overeating. Manage your stress and anxiety, and sleep with your head elevated or sleep on your left side. I put a little illustration here so that you guys can see why sleeping on your left side is going to be for the best. Sleeping on your right side kind of just tips the stomach acid right down into the esophagus. All right, so treatment for overproduction of stomach acid. PPIs are absolutely a good option. They are best used once daily on an empty stomach for 2 weeks, okay? I know that sounds crazy, but it's true. They will actually turn down acid production for at least 3 months. They do not work immediately. It takes 3 to 5 days to start actually working. And what PPIs do is they irreversibly block the hydrogen potassium ATPase pump in the parietal cells of the stomach. So they kind of stay there. It's not like an antacid. So, you know, sometimes I question because I'll have patients who say, oh, I didn't take my PPI this morning and I noticed right away. I'm like, okay, you know, I'm not saying I don't believe you because I always just believe what people say, but it's like, I don't know how that works because that's not really how PPIs are supposed to work. But taking PPIs are associated with an increased risk of nutrient depletion, especially B vitamins and magnesium. Increased risk of C. diff. Anyone who's had to deal with that knows how awful it can be. Osteoporosis, pneumonia, stroke, and gastric cancer. Once again, just because you're not getting the proper nutrients from your food. So as far as PPIs go, if you have to stay on a PPI, for example, if you have Barrett's esophagus, you've got to stay on a PPI. It just is what it is, right? Please consider supplementing B vitamins and magnesium in the least to keep yourself nice and healthy, or anything else that you may be depleted in. Your doctor can check your vitamin D levels, for example, and keep you up to par. Okay, another thing is antacids. They can be taken as needed. If you're taking antacids more than 2 times per week, every single week, you probably need to see a doctor to see if there is a better way that you can manage your, sorry, just letting someone else in, to see if there's a better way that you can manage your heartburn. And antacids start working in about 5 minutes. They're super quick, so it's always great to have those on hand, and they last about 3 hours. So that should be plenty of time for your body to push the food through your stomach and no longer be a problem. Overuse of antacids can contribute to kidney stones and hypercalcemia, or basically too much calcium in the blood, which is not good, anemia, and osteopenia. So we don't want to overuse antacids either. Histamine H2 receptor blockers, this is like famotidine. These bind to histamine receptors in the stomach, reducing the amount of stomach acid, reducing the amount of acid the stomach lining secretes. They do start working in about 60 minutes, so it's not as immediate as the antacids, unfortunately, but they last longer. They last about 4 to 6 hours. Side effects of these include headache, constipation, and diarrhea, and it should not be taken daily without a doctor's supervision. Once again, this clearly says in the package, only used for 2 weeks. So, I don't know. We've got them over the counter, but sometimes it makes me nervous. Okay, for too little stomach acid, we're going to treat too little stomach acid completely differently. The symptoms are exactly the same. The treatment is completely different. First thing you need to do is rule out H. pylori infection. So incredibly important. This is what causes the vast majority of ulcers and stomach cancers. People think that ulcers are due to too much stomach acid. They're usually due to H. pylori, which is due to too little stomach acid. So it's quite the opposite of what people expect. But you absolutely need to eliminate H. pylori if you've got a raging H. pylori infection. Now, treatment can include things like betaine. That's what I talked about earlier. It just basically increases your digestive fire. You can take it either alone, completely by itself, just betaine, or it's also in some combination products. The thing that I love is the Digestzymes or the LBGB. Basically, it just combines the betaine with some ox bile, so it helps with fat absorption, and then also some digestive enzymes that can help with everything. Just helps you to break down your food better. But yeah, that is one of the best options. Apple cider vinegar. This is another super cheap treatment option for hypochlorhydria. Great stuff. And first of all, let me say no to the gummies. I am not a fan of gummies in general. I've just seen so many trials where they test the gummies and they're not consistent. The dosing is like wildly different. I can't imagine that all of the good things about apple cider vinegar would survive like the gummy making process. So I'm going to say no, the gummies are not effective. Now, a lot of people ask me about the capsules. I just honestly don't know. I haven't seen clinical trials with the capsules. So it's impossible for me to say with any kind of real authority or anything to back that up, right? I have seen plenty of clinical trials testing the actual liquid, the apple cider vinegar, for various different things, including the treatment of hypochlorhydria and then also with weight loss. So we know the apple cider vinegar works. Do we know about the capsules? I don't know. Maybe it's hard to say, right? But if you want to be hardcore about it, probably just stick with the actual apple cider vinegar. The way that you can use this is 1 tablespoon diluted in water before meals. It also improves your satiety and can help with weight loss. And it's very important to not let that apple cider vinegar sit in your mouth. Okay, we don't want that acid sitting there. It can rot your teeth. It can damage the enamel. So you want to make sure that you rinse your mouth out right away. Now, another thing that you can do is consider supplementing your B vitamins, your magnesium, and your probiotics at least for a couple months until your stomach is producing proper acid again. You're going to be depleted of these things, so you want to get caught back up. Okay, treatment for physical problems. Sometimes lifestyle changes are sufficient. So those lifestyle modifications that we talked about, spacing out your meals, not eating before bed, all of that stuff, sometimes that's enough. However, sometimes medications may be required, especially in the case of Barrett's esophagus. I cannot say this enough. If you have Barrett's esophagus, you're probably taking a PPI every day for the rest of your life. Just try and work around that by supplementing the things that the PPI is going to cause you to get depleted in. Other options include endoscopic therapy, which basically allows the physician to use a preloaded tweezer and fastener to repair and recreate the valve that is the problem. So this is really nice. It's not very invasive. Great option if that's available for you. Surgery is also an option as well, traditional surgery, where you're kind of cut open there, but it's helpful in cases where you cannot use the endoscopic therapy. They can reinforce the lower sphincter very effectively. And in my opinion, probably worth it. rather than dealing with this the rest of your life, right? Okay, as far as stress, anxiety, and hormones, number one is address the root problem if there is one. Hypothyroid is a classic example. I am not going to be able to do much to treat your heartburn other than just constantly giving you antacids if you continue to have the hypothyroid, if you continue to have this super slow digestion that is just not pushing food through your system, right? So whatever is the first problem, fix that, and all the things downstream will fix themselves. You will no longer need all of those medications and therapies, right? So that's number one. Number two, consider alternative birth control if that is an option for you. It's not an option for everyone. Sometimes you just kind of have to deal with it. But if you're able to try something more local, like maybe the Mirena or the NuvaRing, that's a great choice. Mitigate and manage stress as much as possible. I know, easier said than done, absolutely, but it will absolutely help your heartburn. And focus on lifestyle modifications during pregnancy. Let me apologize in advance to anyone who is expecting. I know that's the worst thing. You hate hearing, oh, just deal with it. We don't really have medication for you. But really and truthfully, it is best to avoid medications during this time frame if you can. I've got 4 kids. I get it. I got so sick and tired of basically hearing tough it out, but that's kind of the situation that we're in, right? Okay, so that is it. Let me stop my screen share so I can see the chat. Okay. Oh, okay. Let's see. Does the capsule test for anything different than the baking soda or betaine test? So the capsule test is just official. It tests for the same thing as the baking soda and betaine test. It's going to test and see how your stomach acid is, whether you have too much or too little, but it's just very official. Then you'll have your official diagnosis. You'll know exactly, yes, I have an overproduction of stomach acid, or no, I'm not making enough. So that's what's nice about that. And then it'll be officially on your record. You'll have peace of mind. These other tests, they're very helpful. I love these little at-home tests to give me an idea, but they're not 100% accurate. So that's kind of the difference there. And the capsule test is expensive and these are free. So that's another thing. My doctor said I have silent reflux or GERD. Now I'm really not sure. I mean, you could even have both, to be honest with you. If you have the heartburn, if you've got stomach acid in your esophagus burning you, and it's traveling all the way up to your voice box and causing issues there, you know what I mean? It could be both. So I'm sorry to hear that. Can the digestizymes be given, or do you have to make sure you have too little acid? You can absolutely take the digestizymes. They're over the counter, so anyone can take them at any time. I think it's a good idea to at least do the baking soda test to have an idea of whether or not you have that. You can absolutely do testing as well to make it 100% official. Like, for example, if you do the GI map test like I did, my GI map showed very clearly you have H. pylori, you have hypochlorhydria. Okay. That test is like $360 though. So, it's a little bit pricey. Once again, going to your doctor, getting the capsule test. It all depends on your insurance and what your copay might be, but you can certainly ask about that as well. How do I get a GI map? Well, I offer GI maps. If you want to do a GI map through me, as I said, it is $360. That's with all of the fees included. But lots of providers offer GI maps. Not a lot of medical doctors. There are some, but yeah, you can absolutely look around and see where you can get a good GI map. It is absolutely my favorite test. I love it. I read them all the time. I've got I have 6 appointments coming up just in the next couple days to read GI maps with patients. And I'm so excited. I can't even tell you, you just learn so much from a GI map about your body. And it also has almost like a timeline. You can see, okay, have you been dealing with this for a long period of time, or is this new? It's just a super, super interesting test. The only thing I don't like about GI map is the cost. Absolutely hate the cost. And when I had to shell it out for myself and my daughter, I was like, oh, this is awful. But it does teach you a lot. Okay. Oh, here we go. I'm on pantoprazole. I promise I can talk today. I have tried getting off by taking every other day, but the heartburn comes back. How do you get off of them? Yeah. Okay. So yeah, that is the best way to do it, is to slowly go to every other day, and then eventually every 2 days, and then eventually just twice a week. You're absolutely doing it the right way. However, if you're still experiencing heartburn, are you doing the lifestyle modifications? You can use antacids to kind of bridge, but how many days have you tried this? Sorry, that's I just need a little bit more information. But yeah, you're doing it the right way. That is absolutely how you de-escalate the PPI. You're going to do it every other day, slow down the length of time in between, use the antacids to bridge, and it should keep getting better and better. So I'm just kind of curious, like how many days you tried it, or was it just like you tried it one day and you're like, oh, I had the heartburn, so what does a GI map consist of? Oh gosh, I wish I had printed off my GI map so I could show you. Cheryl, send me a message in the app and I will just go ahead and send you a sample GI map so you can see it for yourself. The company that I get the GI map through, they have this really cool sample, and it even breaks down like what all of this means, that I can send out to patients. It's so much more helpful than me trying to just explain it on here. But it basically tells you exactly what kind of pathogens are in your gut. If you have serious pathogens, if you've got even parasites, it checks for parasites. Every once in a while, we see those, believe it or not. If you've got all kinds of stuff, viruses, bacteria, all kinds of fun stuff. I was on it twice a day. Oh, okay. Then once a day. After several days or more, the symptoms return. Okay, gotcha. So are the symptoms returning once you're on it once a day, or when you try to go to every other day? Okay, awesome, Cheryl. Yeah, I'll be looking out for your message. I'm excited. Oh, okay. When you go to everything, well, that's great. That's awesome, Diane. So you're already doing an awesome job. You went from twice a day to once a day. That's huge. If you need to stay there for a little bit, do so. I'm not sure how long ago you went from the twice a day to the once a day. Sorry, guys, my kids are kind of running all over the place. Ignore them. But if you need to stay there for months, that is absolutely okay. You're already doing a wonderful, wonderful job. So just like celebrate that, applaud that, sit there for as long as you need to. Once you feel totally comfortable, have absolutely no heartburn, then try to decrease it to every other day and see what happens at that point. Sometimes it's just time. You know what I mean? Your body has to adjust. Think of how long it took your body to adjust one way. It takes equally long to adjust back the other way. Okay, all right. Does anyone have any more questions? Because if not, we'll go ahead and stop the recording.